Now, many athletes then tear their, what we call ACLs, which is a ligament in your knee. We hear this all the time. I tore my ACL.
Yeah.
My son tore his ACL.
Yeah.
And the first thing you do is you go, ooh,
Yeah.
you know, ah. So describe what that is and why it's so painful.
Well, I would say the pain is that generally the ACL requires reconstruction.
Okay.
And so it's a devastating injury from that point because surgery usually leads a prolonged recovery. But what happens in an ACL, unlike this ankle ligament, is the ankle ligament typically stretches or has a partial injury and generally is able to scar in and recover. The ACL generally kind of explodes inside. And so even though a tear is a sprain, it's not something that two ends are able to come back together. Generally, there are exceptions, but for the most part, that results in the knee being unstable. And so what happens is the ACL is supposed to hold the lower leg to the upper leg. And so if you were to go downstairs, the ACL prevents your lower leg from moving forward too much. Now, if you don't have an ACL, and there are people who are born without one, you are able to function. But certain sports like basketball, tennis, being very active, going downstairs, anything that would either result in this force or sometimes a rotational force will cause the person to feel unstable and not able to continue that sport.